my great pleasure to introduce another clinician, a long-time clinician from our clinic, Dr. Philip Lee, who is an clinical associate professor in the Division of Geriatric Medicine, who is also trained in behavioral neurology in Toronto. And we were extremely lucky to pry him away from Toronto because they wanted to keep him. So we're very pleased to have Dr. Lee with us, who will be sharing with us information about how we can live well with dementia. We've already had a great introduction to it so far. So Dr. Lee, please take it away.
Thank you very much, Dr. Foti. I'll just take a second to share my screen here, and we will get underway. I have to admit, first of all, just to say that I'm very glad that the exercises weren't a bit too more vigorous. Otherwise, I'd be out of breath and unable to present right now. So I'm thankful that it was a good workout and invigorating, but hopefully not too bad, so that I can present so I'm not too out of breath right now. It's really my pleasure to be able to share with you some of my perspectives with regards to a topic which I think we'll all agree is a very important and a relevant one, and that's living well with dementia. And I have a couple of confessions to make. The first of which is that with the importance of this topic, I probably won't be able to cover with the depth and detail which this topic deserves within a short period of time. But what I will be able to do is hopefully share with you some of the perspectives, particularly as it's based on some of the research that supports all of the measures and steps that you have been taking and that you've heard about presented today that will go towards a more positive ability to live well. The second confession that I have to make is that it is not for me to sit here and tell individuals how to live well. I understand that everyone's situation is unique. I think we've heard that theme before presented earlier. It's just to say that there are commonalities that we can all sort of look towards that have been demonstrated to be beneficial to people. And I think the important message is that hopefully everyone will be able to take away something from this presentation and this discussion that they can integrate into their own situation. Ultimately, what we're looking for, of course, is defining what makes a person's good quality of life. The definition is sometimes difficult to really pin down, but one definition that you can look up in the textbooks may say it's an individual's perception of their position in the context of culture and their value system. It's multifactorial. There's many contributing factors such as physical health, psychological state, personal beliefs, social relationships, and the relationship with the environment. But if you're sort of like me, I think that that's great to hear as a definition, but I really ask the question, what does that mean? How can we distill that down into what's most helpful? And in terms of how I look at that, I think it comes down to respecting wherever possible a person's preferences in allowing them to live the best life that they can. And I know that there are challenges that exist, and it's not to ignore the fact that those challenges will sometimes get in the way. But if we can try to adhere to the best strategies that we can to allow people to live the best way that they can, I think that we're helping to contribute to a positive quality of life. And of course, we recognize that this is the sum total of multiple contributing factors. So when I read that list at that other slide of many things that contribute, we know that it's not a matter of just looking at one thing that will be the answer to all of the problems. After all, I would love to be able to sit here and tell you that I have the one thing that we all need to do that's going to guarantee us that we're all going to live well and that we'll have a good quality of life. If it were only that simple, I think it would be, of course, much better. But on the other hand, I don't look at this as a major problem, but rather an opportunity. If there are multiple factors that we can think about that constitute our quality of life, we also have multiple opportunities to perhaps look at how we can improve things and work together to, of course, ultimately live better. And the question of why this matters is really important. And of course, intuitively, we'd say, well, it matters. If a person has dementia, it matters to them. Their quality of life is very important. There's no question about that. But we also recognize that the quality of life of those people who are around that person with dementia, whether it's family, other types of caregivers, these are very important things to consider as well, because we know that the quality of life of the caregivers or people around them are also very integrated and intimately tied into the quality of life of the person with dementia, and vice versa. A person with dementia living a wonderful sort of quality of life, saying they're living well, while their caregivers are not actually doing well, is not going to be an ideal situation, and the converse is also true. So the more that we can do to support any network of care that is around a person who's experiencing dementia, of course that will be for the better. And even from a larger perspective, if we look at this, at the impact that this has on our society, if we look at public health perspective, utilization of resources, either by the person with dementia or people who are caregivers who may be experiencing higher levels of anxiety or stress and needing more in the way of medical care and financial costs associated with it, we know that living well and looking at those outcomes can have a major positive impact as a society. So to answer the question why it matters to all of us because it impacts all of us, whether we directly have dementia ourselves or if we are part of the society that we live in. Now, there's varying studies that are out there, and I can only show you a sample of a few of them. But what I wanted to do is focus in on this aptly named IDEAL study, which will hopefully serve as an illustration of some of these important points. The first thing is IDEAL stands for improving the experience of dementia and enhancing active life. And this was a study that was conducted in the United Kingdom, looked at just over 1,500 people with mild to moderate dementia, mostly Alzheimer's diagnosis. And they also looked at caregivers as well, numbering almost 1,300. They took baseline measurements and then took surveys at 1 year and 2 years. And they tried to determine what would define a good living well outcome and how could we predict the factors that would come into play that would help people to achieve those things. And what they found was that the definitions of living well weren't completely surprising. Being well, expressing life satisfaction, quality of life, being able to participate in activities, and expressing positive emotions all went to defining how people would say they were living well. But when we look at the individual components of this, ability to have assets and resources were very highly predictive of a person or carer's ability to adapt to the challenges that they were faced with when dealing with the symptoms associated with dementia. And when we talk about assets, immediately we think about finances, but it's more than that. It's about social connection. It's about relationships. It's about psychological health and the way that we can maximize that in order to minimize the impact that the challenges may have. About the challenges, we have to recognize that there are direct dementia-related challenges, meaning symptoms that affect cognition, behavior, and function. But we also recognize that it's more than that. It's about physical health and physical activity. It's about psychological health. So if we can do a good job in trying to address those issues before they become a bigger problem, if we reduce the impact, the better off people will be in order to be able to adapt. And one of the most important factors that they identified through this study was the access to services. So it was one thing to know that these services exist, but people who are more likely to engage in these services, to seek out help, and to participate were more likely to report better living outcomes. So again, that goes to support all of the wonderful programs that you've heard about presented so far today as very valuable in terms of contributing to allowing people to live the best life that they can by participating. But I want to go into a little bit more detail just to highlight some of the other important findings. We've already heard about how important it is to look at the person as a person and not an illness. Everyone experiences dementia differently. There are unique situations that arise based on a person's experience, based on their environment. We have to see the person and adapt what we can do to help to their situation. So as you heard earlier, Maria Howard was referring to the fact that some people may want a very active sort of lifestyle with lots of exercise and other things. Some people may be more into music or relaxation or yoga or other things. we have to take into account personal preferences when developing a program that fits that individual. Psychological health has also been time and time again shown to have a maximum impact in terms of one's ability to live well. And that again goes for not only people with dementia, but also their care providers. A sense of optimism, self-esteem, and attitudes make a huge difference in terms of resilience to challenges and the ability to adapt. Physical health and well-being, I think this is really important. And we talk about exercise as such a valuable part of integrating in our daily activity. We can do this on our own, but it is also very helpful to consider that formal programs give us really good opportunities to challenge ourselves a little bit more in this field. And even though we can think about the positive impact that exercise has directly on the brain, just even think about it in terms of maintenance of your abilities to function at home. If one cannot negotiate up a flight of stairs, that might make the difference between being able to stay in your current home versus having to move. So the more that we can maintain our physical capabilities, the more that we can maintain our strength and our balance, the better off we'll be in terms of our ability to problem solve and to attend to our daily activities. Another thing that we heard with great description and detail are the different types of dementias that exist. So we know that based on the diagnosis, there may be encountered different symptoms. So for instance, with Lewy body disease or with Parkinson's with dementia, people may be more likely to experience things like mobility problems, or maybe different perceptual issues early on in the course of their illness. If you're able to anticipate some of those problems ahead of time, if you're able to understand what's going on, you'll be better prepared to try and mitigate those symptoms and the impact that that has on your daily life. And that dovetails into the next point, which is as important as it is, of course, to always include the person with dementia in that conversation and that discussion, support of care providers is of extreme importance as well. And sometimes that means providing opportunities for their exploration of understanding of the condition, allowing them to ask questions, or quite frankly, allowing them to be able to talk about their own health issues. So recognizing that connecting care providers with the appropriate supports, not only directly benefiting the person with dementia, but for the care provider's needs is also very important in terms of improving living outcomes. And as you'll probably hear about in a few of the presentations just coming, the importance of addressing comorbidities. We've already heard about high blood pressure, diabetes, and some other conditions. We know that the presence of concurrent medical problems, if not addressed appropriately, will certainly magnify the situation and make living well more difficult. Ultimately, one of the things that really struck me from this research is the importance of having an identified healthcare, and I'll add, or social care provider that one can turn to with questions and to receive guidance along the way, along the journey of dementia. So the importance of this is that we know that unfortunately a majority of people will say they don't necessarily have that connection that they can turn to if they have questions or if a new problem arises. The ability for people to access resources through case management, through the local health unit, or perhaps to be able to converse with a nurse, a physician, or another healthcare provider who will be able to give good advice with regards to what the problem is at the time when a person's experiencing it is quite crucial in terms of actually encouraging opportunities to live well. We've already heard, I think people allude to the extraordinary circumstances that we're living under with COVID, is just to recognize that as much as we all need to adapt our behaviors and our daily activity as a result, the impact that COVID has had for people with dementia and their carers is even magnified more. I've had many people describe to me how there has to be many explanations about the importance of hand hygiene, about physical distancing that have to occur almost on a daily basis to remind and to keep people safe. The other thing is the availability of services and supports which temporarily have not been available because of COVID has been needing to mean that we've had to be innovative in terms of what's being offered. And I'm so glad to hear that there's been integration of Zoom technology and other opportunities for this. I will say that the more that we can do to make this information available to support people during this time, I think, of course, the better. And this is just an example of how life events happen, and we have to be prepared to deal with that when they come up. So I'll summarize with just saying the following. Again, I wish I had one thing that I could tell you that you should do and you will live well. I think rather I would summarize it by saying this rather obvious but necessary statement. Whatever makes your life easier, maximize that. Whatever makes it more difficult, try to minimize it. Focusing on well-being and satisfaction with life is very important, not only for the person with dementia, but for all of those people involved in providing support and care. What constitutes living well is not static. It's about living well through the journey. And I think that what we need to recognize is, as much as we encourage, of course, the personalized routine that people attend to, formal programs like the BC Wellness Program or Paul's Club or connection with the various programs offered through the Alzheimer's Society of BC are essential in terms of helping people to maximize the benefit that they can obtain. So finally, I will finish off by saying it's important to recognize you need to know what's out there, but make whatever's out there fit for you and work best for you. Because after all, we all deserve to live well. Thank you very much.